Welcome to today's episode of BMC Global Live AL-HILAL Health World, Nothing But Lifestyle. Back pain is a common issue affecting both men and women. And there are many reasons for the back pain, and one of the common reasons is the disc related issues. To throw more light to the topic, we have with us Dr.Shafeeq Muhammed from AlHilal Hospital, Manama Central. So without losing time, let's move on to the topic. So doctor, welcome to the show and thank you for joining us today.
Thank you for having me in the show.
So it's a pleasure. So doctor, we know that back pain is caused by disc related issues. Can you explain about the disc prolapse in detail?
Okay, intravertebral discs are just like a shock absorber which is placed in between your vertebral bones. So the basic structure is like we have a jelly like material in the center and we have a tougher outer portion which is called annulus fibrosus. So once this annulus fibrosus get weakened and all this jelly matter comes out and herniates through the pores and it compresses on the nerves which is going down to your leg. So that causes the disc related issues commonly.
So what are the common causes of disc prolapse?
Common causes in younger generation, it's mostly due to the changed lifestyle. Basically the people who are working in an atmosphere where they have to sit for a very long time and all, they won't maintain a better posture and all. So what happens is the bad posture leads to increase in the intradiscal pressure and can cause a disc prolapse. And another reason is trauma. Injuries can also produce the trauma related injuries to the disc and that causes the herniation of disc and compression to the nerve. And the third reason is degenerative, that is usually seen in elderly patients. Elderly patients can have degenerative changes in their bones as well as the disc matter and that can lead to disc prolapse and compression on the nerves. That can also produce symptoms of discogenic pain.
Okay, so these are the common causes of disc prolapse.
Obesity is also a cause. Obesity and lack of exercise can also lead to disc related problems because when you are overweight, your spinal muscles has to work more and more pressure will be on your intravertebral disc. So that can also produce disc prolapse issues.
So if a patient comes to you with disc prolapse, what are common complaints they have and what are the red flags we should look forward to?
Okay, various symptoms are seen in patients, but it totally depends on the stages of disc prolapse. There are few stages in disc prolapse. First stage is a stage of degeneration, second stage is a stage of disc bulge, and third stage is stage of extrusion, and fourth is stage of sequestration. In initial stages, it will be confined to back pain only, where there is only degeneration, the disc material won't be prolapsed that much. And in case of a disc bulge, the material will be coming out and pressing on your nerve root. That can produce back pain as well as shooting pain to your buttock and your legs also. And in case of a disc extrusion, the patient can also experience back pain associated with weakness and numbness on the lower limbs. And in a stage of sequestration or the last stage, there won't be much back pain, but mostly it will be like numbness and progressive weakness in the lower limbs. And the red flags, there are few red flags which is alarming. Like if you are having shooting pain to both your leg and buttocks, then it's a alarming sign. And the second sign is if the disc problem is affecting your bowel and bladder control, just like some people will have increased frequency of micturition, difficulty in defecation, and all these are alarming signs. And another one is progressive weakness. Some people might be having progressive weakness on the lower limb, like they will find it difficult to wear a chappal. That can all that are all are red flag signs in a discogenic pain. So that needs immediate attention and care.
Doctor, what are the tests to be done to identify disc prolapse?
Actually, when a patient visits with a back pain in OPD, we first clinically examine the patient to see whether there is any signs of disc prolapse is there. Like we can see paraspinal muscles in spasm and straight leg raising is painful. For that patient, we usually do an X-ray. In X-ray we see that whether there is decreased disc space is there, because in between the bones the disc is situated, and in a case of disc prolapse there will be narrowing of disc space. And the second thing we look for in an X-ray is if there is any change in the alignment of the bones, like when there is a paraspinal spasm there will be straightening of the normal curvature in the vertebral bones. And the third thing we look for is the bony changes, which is usually seen in elderly patients like osteophytes and all, syndesmophytes, which we can see in an X-ray. So these are the primary investigations we do in a patient with back pain, which is suspected to be a disc prolapse. And sometimes some other conditions can also give the same symptoms of back pain, so we need to rule out that thing also. Mainly for female patients, there is a chance for that urinary tract infection can also produce a back pain. So we will do a urine routine test for female patients, and in some patients if the back pain is associated with fever and all, we have to rule out infection also. So we will do blood tests to rule out infections and other problems also.
So once a patient is identified with disc prolapse, what are the treatment options you go for?
Okay, for the initial stages of disc prolapse, we can treat it with rest and heat therapy, physiotherapy and all. We usually give a dose of medicine for first 1 week, so that we can see that the pain is decreasing, the muscle spasm is decreasing or not. If it is getting better within a week, we can start physiotherapy to decrease inflammation and muscle relaxation also, and they will teach them some exercise to strengthen their back muscles also. For some patients, even with this treatment, the pain won't be coming down. If the pain is increasing, if there is progressive weakness is coming, and if there is numbness and weakness in the bilateral, even in the limbs, we have to go for further investigations like MRI. And for that, we have to send the patient for MRI and wait for end report. And the treatment will be depending on the MRI report of the patient. And after a conservative treatment, if the patient is not finding it helpful, another treatment method which is available is we can go for injections like epidural injections, which can also decrease the pain. It is another modality, and if even with the epidural injection, if the pain is not coming down, then there is if the weakness is increasing, we can go for a surgical option. Right now, the surgical options are to do a endoscopic discectomy, which is can be done as a daycare procedure, which is not a very large surgery like opening the spine and all. We'll make a small incision only. It can be done as a daycare procedure. You can be admitted in the morning and can be discharged in the same day or next day morning. So that are the surgical options available for the discectomy or the discogenic problems.
Doctor, many people have the fear that after surgery they will lose their mobility. So what is your suggestion?
Actually, that is a misconception about the spine surgery. Spine surgery has changed a lot from the last decade to now. It is like we can do endoscopic surgery. It's only a 1 centimeter wound in each side of your spine. So with the proper physiotherapy, the mobility won't be affected, and the patient can go back to the normal life and can do their day-to-day activities and all within few days of surgery.
Okay. Do you suggest rest for the patients with disc prolapse?
Rest for the patients is only suggested for initial part of the pain. When we are treating the patient, we are asking them to take rest for maybe for 2 or 3 days maximum. After that, we would suggest them to do their day-to-day activities. We definitely want them about lifting weight and all, avoid lifting weight and sporting activities for a few period of time.
Okay. Doctor, what is your advice for the patients with disc prolapse?
The patients with disc prolapse, if they are suspecting a disc prolapse, they should get a medical attention for it firstly, to get it diagnosed properly, and if it requires a scan, they should go for MRI scan to see that how much prolapse is there. According to that, treatment should be formulated according to the MRI report and all. and the thing is they have to make sure that they are not doing something like bending forward and lifting weight. They can avoid riding two-wheeler, avoid sporting activities. They can do spinal strengthening exercises and avoid climbing stairs unwantedly and all. That are few things we would suggest to the patients who are having disc prolapse.
Doctor, what are the lifestyle changes you recommend for the disc prolapse patients?
So basically, it is always better to maintain a good posture when you are working. If you are sitting for a long time and working like that, it is always better to maintain a straight posture. And while you are sleeping, it would be better to keep a pillow under your knee if you are having a disc problem, or else you can keep the pillow in between your knee and lie down sideways also. And another thing is weight reduction. It suggests the patients with disc prolapse to decrease weight so that the spinal muscles will be more strengthened and they don't have to work more they don't have to work more and increase stress on the already prolapsed disc.
And before we wind up, doctor, what do you have to say about AlHilal Healthcare?
AL-HILAL is one of the fastest growing private healthcare provider in Bahrain, and in Manama we have a team of doctors who are working. We have orthopedic related problems, and we have surgical side also. So we work as a team for the betterment of the patient, and we have a good physiotherapy department also.
So thank you, doctor.
Thank you.
Thank you for being with us and giving us a lot of valuable information about disc prolapse.
Thank you.
Thank you once again. So viewers, I hope you got all the valuable information about disc prolapse. And for more informative episode, tune into BMC Global Live AlHilal Health World every Tuesdays at 8 p.m. Till we meet again in yet another episode, this is Jasila Mujib signing off. Good night.